We appreciate you.
Yeah, huge thank you to Melissa and Taylor for all the work that they've done organizing the Bryce Canyon registration. It's been a lot more work than they anticipated, but
I didn't get on that. Get registered.
oh yeah, I was going to mention we've got 131 people registered so far, and it is first come, first served. So definitely make sure to register if you're interested in that. Child, of course, as soon as I hit record, my daughter calls over and over and over. It's always how it goes, right? Welcome everyone to the March UPCA webinar. I'm super excited that we had such a big turnout. I've got a few announcements before we jump into our amazing speaker. I did want to mention in the chat link, we've got the link to our attendance log. So please feel free to log your attendance if you are here. If not, don't, right? I also wanted to mention our Bryce Canyon Coalition Summit is being held June 12th through the 14th. Like I mentioned earlier, registration is filling up fast and it is first come, first serve. So please make sure to register if you're interested in attending. Our Bryce Youth Leadership Summit is also June 24th through the 26th, and the planning committee for both of those conferences have been working really hard to make it a really fun experience for your adult coalition members and your youth coalition members. The registration for the youth summit should be coming out soon, so definitely watch for that. And we did send out that save the date. It's going to be a really fun time. I also wanted to mention that the UPCA Executive Board has been working really hard since December, I believe, on updating our bylaws and our tagline for the UPCA. So be on the lookout for that. We'll be sending that out probably within the next week for approval. Definitely, if you have a chance, please feel free to review over those bylaws and the tagline. Let us know what you think, and maybe we could take a formal vote on that next month. But we'd love to just get things updated and continue to make the coalition as effective as possible. I also wanted to say a huge thank you to all of you for the advocacy work that you did during the legislative session. I can't stress this enough, and I'm sure Susanna will as well. What an impact that we were able to collectively make. I heard from several prevention advocates just how amazing it was that we not only mobilized our adult coalitions, but our youth coalitions, and how many policymakers actually spoke to that. Like mentioned that they specifically remembered meeting with the youth and hearing from the youth and the concern from the youth. So that was really awesome to hear. So really, thanks again. And we'll also be sending out this week a Google form evaluation of our advocacy work during the legislative session. We really want to be as effective as possible, and we really want to do as much as we can to support you as a prevention specialist and your coalitions. So please feel free to take this very quick. I think it's a 9-question survey. And please be honest, your email addresses will not be collected, but let us know that what we can do to support you and to help your coalitions so that next year we can be even more effective. And I also wanted to give Maggie a moment to mention the NAMI walk that's coming up.
Yeah, thanks, Heidi. Hi, everyone. So NAMI is having their annual walk this year. It's going to be on May 18th at the Veterans Fair Park in West Jordan. So if you want to go to NAMIWalks.org/Utah, you can register for there. There's several ways that you guys can participate. You can gather with teams, which is fun. Like each coalition can have a team. If you want to have a table, we can arrange that. And also, if you guys want to sponsor, there's it's all on the website. Again, it's at NAMIWalks.org/Utah. So our walk is on May 18th. Just come out, have fun. It's a great time. It's a way for all of us to get together and break that stigma of mental health and also substance abuse, because everything's kind of all under the same umbrella overall. So thank you.
Awesome. Thanks, Maggie. And I did want to mention that Melissa and Taylor are both on the webinar today. So if anybody has any questions related to the Bryce Coalition Summit and registration, feel free to hang on at the end of the call and get those questions answered while they're here, right? So without further ado, I'll turn the time over to Susanna, who has graciously offered to take us through a legislative recap of this last policy season. Thanks, Susanna.
You're welcome. And yes, thank you so much, everyone, for all your involvement with legislative session. This was a really, really crazy session, and there were some really good things that came out of it. And to be fair, this is probably the most contentious, divisive session we've had, where there was a lot of involvement where we didn't get to see, like, that we were not invited to, or backroom deals, a lot of stuff that went on that was arguing, hey, Richard. I'm like, Richard will pipe up and tell you it'll be a great thing. But overall, you all came out, and I appreciate that so much. I know that the whole system is better because of your involvement in this. So this is how a lot of us are feeling. We're done. It was that last day, like when things got passed on Senate Bill 61, the last day, it's like, oh my gosh, my stress and anxiety went up, but we're good. We're passing. So today I'm going to try and keep the PowerPoint pretty quick, and then I'm going to show you a document that I will be sending out the end of the day today, and I will tell you who got to do that lovely document for me. But this is what we're going to go over: building relationships, communicating what's coming up this next year, and then we'll go into the bill status and which key legislators we want to touch base. So now that the session's over, that doesn't mean we ignore them until next January. This is the best time to be building your relationship with your local legislators. Thank them, send them cookies, say, I appreciate it. And you'll see what you will have some stuff to thank them on in a minute. Or you'll see what I mean, but have your youth go build a relationship with them, invite them. I extended an invitation to Senator Stevenson, to Karen Peterson, so Representative Peterson. Oh yes. And Representative Burton to attend a conference with us, with Heidi. Unfortunately, they are unable to attend, but that invitation was there so they know who I am, who Heidi is, and we can continue to build that relationship with them outside of the session. Richard Nance and Art Brown have spent years where they build that relationship with different legislators before the session starts. And May is when the interim committees begin and the bill files can be opened. So there's a lot of stuff that you can do now beforehand. So definitely go for it. Richard, were you gonna say something?
No.
Okay. But these are the things that we want them to do. Invite them to events. If you have a policy or idea, send it to them. We have a couple of people that are changing. They're not going to come in. So Bramble is retiring. Got different legislators in the area in Utah County that are leaving and just not running for re-election. Look into who's running. Build support now. Get them engaged with prevention. Do not wait until November and do not wait until January to get them involved. Okay. When you are calling them, because I'm going to show you who voted what, you can, this is just consistent. Identify where you live. Identify what coalition you represent, more that you're a constituent. When we know the term, I used it last time, honey is better than vinegar. We want to build a relationship, be cordial with them, educate, listen to why they have a passion for something. Educate them on the facts. You can make it personal, but also stick with something that's not a personal attack, but something that's really going to change their community. You're not telling them how to vote.
And then talk to them.
There is somebody who is just, oh, does somebody mute? Okay. And do thank them. Thank them for their time, thank them for their service, thank them for all they do. Okay, ask them about a percent rate, but don't demand. Thank you so much, Richard. He's one of my mentors right now to be doing this, by the way, and I appreciate that time. And I'm serious, like, if you don't feel comfortable with policy, let's all hang out because I'm learning and growing, and I'm the chair here, and I'm learning just as much as you probably would. So that's why I'm spending time with Richard and with Art and with Liz Kelt to make some better connections so that as we continue to grow, it's built in and I understand it. So here's some ideas. We have the first bullet point is kind of what we're looking at as state. So those first four that are the subset, those are state level initiatives that we're looking at, we're going to discuss. These are not exactly at, it says we are looking at. These are things we're proposing. So we're proposing to look at changing the vape cartridges to be taxed at the same amount as combustible tobacco. We're looking at things that we could write for marketing and medical cannabis. We're looking at the alcohol tax. We got a lovely, like less than a penny a drink tax this time, but also enhancing our DUI support. Oh, you cannot see my PowerPoint. Maggie, does everyone else see my PowerPoint?
I can see it.
Yeah.
Okay. Maggie, I'm not sure why you can't see it. Look and see if there's a way that, well, we will send it to you. I will send you everything, Maggie. Okay. And then another one is enhancing DUI support. And I've read it like that because it's very, I wouldn't say very complex. There's a lot rolled up in this discussion. Heidi and I don't know if you all knew, but that UPCA was selected as part of a cohort for Alcohol Policy Institute. And we were working on one, which because that 1 penny per drink alcohol tax passed, we're not likely to get an alcohol tax passed next session, but we can hope and dream. But we thought maybe there's something else we should work. And what the rest of the nation is kind of hoping and looking to Utah, since we were the first state to pass a 0.05 blood alcohol content minimum or maximum for DUIs, we are also the one that everyone looks to for our data. So when our DUI data is going up and there's crashes and fatalities that they're seeing the rates go up, which we're experiencing, they want to know why. And so that's something that are there ways that we can discuss to change this. So that's why it's just enhancing DUI support right now. But that's something we're going to look at maybe addressing. So those are all state level. Now, at a local level, so something that's very much either your local elected officials or like your mayors, your county commissions, and even your own representatives. But you can look at ways to support these policies. There's already a social host law on the books that already exists. Is there a way to make sure it's being enforced? That's something to look at your community and see if it's been enforced, see if they even know what's going on. Are there beer gardens at some of your local events that are not adequately supported? Or are they eliminating beer gardens and allowing the alcohol to flow freely through the event? Again, something you can look at your own local ordinance for city or county. And then we're still looking into this one, so be very cautious with this next one. Rewards and reminders. You can go do an environmental scan, which means you're going into a business and you can identify whether or not they have the policies written up, or we ID at 21 or everyone between these dates, or they may not have things correctly locked up. That you can still do, but it's the reward and reminder component of it, which is, hey, we noticed this is going on. They may interpret it as compliance checks, and these are not. So we're still looking into what we can and can't do, but we want to recognize those who are doing well, and we want to encourage those who could be doing better to do better. That's all. And lastly, looking at easy compliance in your area. Is it being done? Why or why not? Those are all things you can do locally with your cities, your local law enforcement, and your counties. So those are just some options for you to be thinking of for your coalition. Okay. This is my contact information real quick. If you do not have it, now is the time to take a picture or write it down. I am going to quickly change in a second to my other document, but don't hesitate to reach out and ask me questions. I may not have the answer. I'm just going to tell you. I will probably ask other people like Liz and Richard and Art, but I do think it's really important and valuable for you to get involved now. So, all right, I'm going to stop sharing that screen. I'm going to share a new screen. So, all right. Okay. Now I must ask, somebody can unmute, is this large enough for you to see some of it? If you need me to make it bigger, I need to know. Okay, thank you.
Yeah.
What this is, and this is the document that my wonderful, amazing intern did, Kendra Crittenden. She graduates in a week, so very excited. Hoping to keep her on. But back in the day, actually, for those of you who've been around long enough, Michelle Swap actually did this with at least Richard. I don't know, because she was your staff, if it was locally or if it was for the whole state. But I had her go through, and can you see that? So she made a lovely bill list of all the bills that we were tracking. Then from the House and the Senate, who voted what on each bill and if it passed.
Yeah, that's great. That's like page 1 of the report card I used to do.
I know, and I think, let me see if I have. So here's where it starts. You'll notice in this document, she also put where these representatives serve. So if you don't know who's serving your area, this might give you a place to start of the counties. And we did counties rather than cities because some of them kind of blend over certain areas. So you may have to like see specifically, because those, if you in Salt Lake, there's a lot of different people. But this was really, really helpful. And I hope it's helpful for you to kind of get an idea of who are your allies, who are going to be supportive of some of the strategies that you're looking to endorse. If they are open and amenable to different policy that we want to support. But she did that for the House and for the Senate. And I was thrilled with that. So I'm gonna send that out to Maggie today, and Maggie will send that out to the rest of you. So you have that for you. This is the final copy. We did a little bit of editing and whatnot, but if you have any questions or you find something, let me know. So the first thing is that we have roughly 29 bills and we're at 1221. We're not going to spend a huge detail amount in all of these, but this is, again, a document you can go back to and look at who sponsored it, what was it about, did it pass, where did we feel it sat? Like, was it something we were supporting or not supporting? So as we go through this, keep that in mind. We can do a deep dive in some of this, but we are going to just do a very quick review of some of these because not everything needs a huge amount of our attention. So you'll notice House Bill 33 and 38, both of those passed. We did support that. The governor has signed those. Whoops, I'm trying to make sure I'm not going too fast. Industrial hemp amendments. This is one of the ones that we had concerns with. It did pass. The intent for this one was to make it match up with the federal law, and that's what it was. We did support it in concept. We had some concerns with the language, but as it sat and how it was passed, it's not a horrible bill. It's not an amazing. It just brings it to match up with the Department of Agricultural and Food, FDA kind of area. So, House Bill 106. That was Judy Roner. That was the first one that we had talked about really being a priority bill. While it didn't pass, don't be sad because we moved from House Bill 106 to Senate Bill 61. So there were some, that was specifically for the nicotine content, and House Bill 61 got us so much more. House Bill 128, I just saw that it was signed. This is so that, and we had priority supported this one to encourage the youth that are going through that they can still go through a tobacco cessation strategy. It is not including like a patch or nicotine gum, it's coaching. And previously it required parental consent, and now they do not need that parental consent. Yeah. That is correct, Richard. We do have an ally in Representative Runner. So keep that in mind. Student survey amendments. Yay! Everyone was so thrilled. Anyway, this one was a really hot topic. And for those of you who did come out and speak, I do know that there was a number of you that came to speak. Thank you so very much for taking that time. Your voices were very valuable and heard, and it was awesome to hear those other than myself and Heidi speak up to this bill, or again, speak up on this topic. What this means, and this is something for you in the local area to keep in mind, and I have a draft of an email I'm sending to my school districts. They are all required now to do it within their registration packets. So you must have, if you want your students to potentially participate in the Student Health and Risk Prevention Survey, SHARP, or any other non-academic survey, like Panorama or a climate survey, those need to be identified and have permission signed at the beginning of the school year, meaning in the registration packet. Guess what? There's a lot of schools that are doing their registration packets right now. So keep, Maggie, are you saying no, they don't? Like,
I just registered my son and there is nothing on that.
right. So that's one of the things that does go into effect as of July 1. So we have a little bit of like a gray area there, but still, we want to make sure that your school districts are aware of that change and that they know what they can do and what they can't do. And thanks to the state level group, and I'm going to only call out Heidi, and I don't know who else is on the group besides Heidi. It's the question or the issues that they came up with all new resources for us to share. And so that's one of the things I'm sharing out with our school district. So that's something, again, we can also pass along if you're interested in sharing that and advocating for that. Questions so far? Okay. House Bill 202, student athlete amendments. This was one that we didn't entirely go through in UPAC, but the issue that it came up for UPAC is that they cannot promote tobacco, e-cigarette, or alcohol. I would love to have seen gambling in there as well. I think that that's something else that's going on, but this did pass. Office of Families. So that's a new office within the Department of Health and Human Services, and it will be connected with a lot of the prevention efforts. And so we supported it. And Amy Winder Newton is the director of that office right now. So that's a positive influence. Medical cannabis pharmacy modification. So House Bill 389. This is from Representative Walt Brooks and Senator Vickers. We had concerns of this and we opposed it because of the number of closed door pharmacies that would increase, and that it would allow basically more of that outside influence to come into the state and push for delivery, for access to cannabis. We understand that it's still medical, but there are limitations, and it's concerning. I just noticed it. Richard wants to know. Okay. Richard, will you explain your last comment about the administrative rules?
Right. We put a lot of effort into this the last year or two over the vaping nicotine content issue. You're all familiar with that. What happens is once a bill is passed, then the administrative department has to write rules on how to implement it. So that's one thing where we still have a chance to have some influence. So even things we don't like HB 435 there, truth in advertising. I'm not sure where that's going to fall in terms of administrative implementation, what state department that falls under. But we have an opportunity to participate in the rulemaking process through public comment. And remember, with nicotine content, I think at one point had as many as 800 comments
Yes.
that we were able
Yeah.
to organize. So all these bills, just because they passed, they still have to be implemented somehow. So there will be a rulemaking process for every single one of these bills. And that gives us another opportunity. So that's a little more opaque than the legislative process.
Okay.
But it's still something that we have to monitor and stay involved with. So just because the legislative session's over, our work on all these bills isn't done. For instance, Senate Bill 26 creates a MASHs and addiction counseling license here in Utah. That'll be administered through DOPL, and part of the administrative rulemaking process there is how people apply, what the details are with regard to degrees and coursework and previous licensure and so forth. So that was something that I was involved in during the legislative session, and I'll be involved in the rulemaking process for that as much as I can be. And we'll try to get others involved in that as well. But, all of these things are probably, and there's a separate, oh hell, I can't remember what it is. What's it called now? But there's an administrative rule website that we'll need to monitor.
So for the public comment?
Yeah.
Okay.
And you can actually go beyond public comment. There are meetings to discuss, and propose rules. And if there are ways to attend and participate in those, I think that's a good idea for us to try to do too. That's
Okay.
not anything I've really been directly involved in the past, but yeah, it's like the extra point after the touchdown. You've got to stay involved until the rules are done.
Okay. Well, and what I'm hearing is that this is another way, and a continued way for us to remain involved and have our voices heard.
Exactly.
So, as the policy chair, I will still listen and be listening to where we can send that out and engage you throughout the year. So
Yeah, I mean, our friends in the state offices really can help us do that. Like Rob, I know he's on the call. He should be able to inform us when we have the opportunity to, contribute to those discussions.
Thank you. So we do have, I'm going to jump down to the truth in advertising.
Thank you, Heidi.
Truth in advertising. It did not pass. And we supported it. And it talked about basically how people can promote and advertise their goods. So whether it's CBD or whether it's cannabis or alcohol, what is it that we want to make sure that there was a clear truth in how it was promoted to the community. Then we have social media amendments. That one was passed. We supported that in concept. This limits that electronic communication. It talks about our bullying and things, and this will be dealing with a lot of stuff at the school. So again, another way for your coalitions to get involved. Then you have the alcohol amendments. House Bill 450, not 450, 548. This one, I didn't love it at all. But it did pass. We opposed it as a UPAC, and basically because it really did change some of the increase of the number of licenses, it increased the access, I felt, and it did not adequately fund prevention or strategies that are looking to curb the use of substances like alcohol. So that's something, that's a big one. Every year they do one big alcohol bill, and that was it. Communication awareness pilot. This is a pilot with the Health and Human Services, really small amount. I don't remember reviewing that one. Then flavored tobacco restrictions, that one didn't pass because again, we're going to get to it, Senate Bill 69. Controlled substances revisions. This is with Ray Ward. I don't think we reviewed it, but it did not pass. Behavioral health amendment, system amendments. This is the commission. And this is what's going to impact USAVE and UPAC. And we have an opportunity to really strengthen the voice of UPAC and our communities. And we're hoping that continues, but there is some concern with the Behavioral Health Commission. What is it going to look like and how is it going to play out? My concern is always making sure that everyone who is on this call or is a professional can be considered an expert. If you're a community member, you have a voice that can be heard. How transparent will the new be? And how will that play out? With that said, it was definitely something that the governor supported and endorsed. It came from as a result of the behavioral health master plan. And there are ways that can be really, really good, and hopefully streamlining some of those efforts to increase resources and capacity of communities to decrease our mental health burden. Here is Senate Bill 61. This one was hard fought, everyone. Like the amount of time that Senator Plum and a variety of people were just hammering this out. And I need you to understand, this is an amazing bill. There's not everything that we get, like, it's not like, oh, it was voted through. It was amazing that Utah got this passed. And only a few people voted against it. So with your voices, your youth voices, all of that really pushed this to the finish line. So thank you so very much. And I keep wanting to say representative, but Senator Plum really needs to hear the support. And so thank Senator Plum. She did a great job. But this one, first in the nation, that registry for electronic cigarettes, it prohibits the sale of flavored electronic cigarettes. That's amazing. Amazing that we got through that. This is one that I think that, just to Richard's point, this is the administrative rule that if they have to do something, we got to watch this.
Right.
So we lost it last time. But that was amazing. Good job, everyone. Cannabis business tax credit amendments. This one, so Senate Bill 71, this is where basically because the federal government sees cannabis business as still breaking the law, they have to pay on things they can't count it as a tax deduction. This was allowing for some of those tax deductions for those who are selling medical cannabis. I hope that it's clear on why we were beheld and we opposed. It was not a well thought out. Let me rephrase that. This bill has a lot of unintended consequences that are going to impact communities by allowing the cannabis businesses that are medical cannabis to make more money and not any more oversight. So. School climate data amendments, this one did not pass. It was UPAC supported in concept. We don't need another survey, but we also understood why they wanted another survey. So that's something just to keep in mind. The Children's Device Protection Act, this is about not having phone in school or monitoring or minimizing it. They supported it, it passed, governor has signed it. Office of Student Affairs creates that office within the department. It did not pass, it's holding it. There were a lot of concerns with what, again, it's a broadly written approach. We're not against student health affairs. It just may not have been the best strategy. Electronic cigarette and other nicotine products. So this is basically a reporting one, if I remember. Yeah, this is a reporting one. We supported it, it passed. Then we have public schools, we're almost done. I swear there's only like 3 or 4 more bills. Public school discipline and conduct. It aims to create a pilot to support schools. And governing process, again, I think it just basically gives our local schools a little bit more support. And give them some more stuff. I'm sure it's some sort of unfunded mandate. And then the medical cannabis amendments. Oops, sorry, I'm trying to get it so it's not there. Increases the delivery access for more type. We did oppose this. There's also already things on the books for where if you live in a certain area that you can have it delivered, but this increased the likelihood of where it could be delivered mainly to a PO box, which I can tell you it has there's some concerns there. Opioid settlement proceeds. And then this is basically a reporting one. We supported that, and medical amendments that authorizes the healthcare system to create a pilot program, certain drugs. We did not fully review this, but this one has concerns. This particular bill, it did pass, and it passed without much conversation or discussion, but it allows our healthcare providers within the state of Utah, a few of them, a system to do this, to allow a patient to receive ketamine, psilocybin, or MDMA, which is ecstasy, if it's monitored with the help of a physician. The concern we had was that there is a study currently with Johns Hopkins that they're going to look at the effectiveness of this, and we would rather see the data before we start doing this. But the hospitals and the providers are looking at new and innovative ways to treat issues. I understand this. I still prefer research, and we want to make sure that there's some limitations on this, and it is still a little bit broad. So those are all the bills. Question. Okay, so I'm not going to go through who voted on what, just so you don't panic, because that would be like mind-numbing. But I am going to send this out. What we've done is that if it is, so green, it passed, red, it did not pass. If it's purple with the asterisk, that means that these could potentially impact the Student Health and Risk Prevention Survey. Okay. Underneath it, they have yay, nay, or they were absent, or they didn't vote. So that's all the things over here in this column. This is the counties for where they serve. Yes, Heidi.
Oh, I was just wondering, what if your policymaker flip-flopped? We had a few in our area that initially voted no, but then they voted yes the second time. So how would that be listed on here? Just their final vote?
The final vote is what we went through.
Okay.
That's good to know, though. I'll look at it. But I'm sure that Kendra would love to go back and do it again if I asked her. Well, she's graduating. I don't want to bug her. Okay, Richard.
I just want to make sure everybody notices the detail here. Good news for us is that most of the bills that we supported um, passed, and most of the legislators voted yes on the ones that we wanted to see passed. So
Okay.
we may not be happy with some of the outcome, but in the grand scheme of things, and this happens year in and year out, um, we do really, really well in terms of our policy initiatives in the state legislature. Um, so that's something to be happy about when you look at all the green on this.
Yeah, and that I would second that. Again, there are some really great things that happened this session. And it's 4:35. I think it passed. Or H. It did not pass. Oh no, we did not support it. Oh, still didn't do it. Let's say, truth advertising. It was not voted on in the Senate. So that's why Brian. So, so again, so there's one tab for Senate, one tab for House, and it had to pass in both of them. And sometimes I had to go back, as Heidi referenced, like it came through the House, went to the Senate, they changed it, had to be voted on it again in the House. A couple of times it went back and forth. But this was a contentious session. And while there are really great things, this is why it's so important for us at the local grassroots level to get involved and build a relationship with our legislators now. Do not wait. Do not wait until something pops up. You want to work with them. And it doesn't have to be like, hey, here's this brand new policy I want you to do. Right? It could just be, hey, thanks for your service. I know you spend a lot of time. Those of you in Tremont area, Scott Sandoval actually stays in Salt Lake. And that was interesting to me. Like there's some that actually he could have driven down every day, but he stayed in Salt Lake so he could be there. And they start working before 7, and sometimes they don't finish till at least midnight. Those are long days. So whether I agree with everything or not, they provided a service. They volunteered for this. They asked to be elected. They have a platform. They're working hard on these things. So we appreciate them. Build that relationship. I cannot stress that enough. And again, invite them to be a part of it. Invite them to come to a meeting or an event you're having this summer. Let them see the good things that your youth are doing. Let them see what it's all about. Have an like a coalition meeting tonight is a kickoff in Roy area. That'd be a great opportunity for you to say, hey, Representative Quinn, we'd love to have you join us today. We know that you are in the area. We want you to come be a part of this just to see what we do. That's it. If they say no, they say no, but at least offer. Questions for me. I'm going to draft my email while I'm waiting for questions to Maggie so that she can send this out really quick. Because I want it to be available for you immediately.
I have one. I really appreciate your list of priorities for next go around. One of the things that will start happening is interim meetings. And so we need to make our legislators aware of those priorities now. So if there's an opportunity for them to be brought up during interim, that's a plus. One of the reasons we got the Masters of Addiction Counseling bill passed is because it was part of a committee bill. And those are produced during the interim period. They usually get a low number. And because they're committee bills and have been worked over during the interim period, they have a lot higher opportunity to pass. So now's the time to start. Starting any later with this kind of puts us more and more on the back foot the more time passes during the year. So I think also we ought to see what other ideas people have to add to our list.
Yeah.
One of the things that I think we ought to be happy about with the alcohol policy list is that a couple of interesting things got put in there that are really youth prevention oriented. And one of those is it's now illegal for products that are designed to be frozen for consumption that contain alcohol to be sold in Utah. So that's ice cream, popsicles, Otter Pops, and things like that. What else do we get as part of that? Heidi, do you remember? Susanna, do you remember?
I can pull it up a second.
Powdered alcohol was one.
And vapor or aerosol.
Oh, and
Yeah.
vaporized alcohol was another. So that'll be an interesting thing to look at in terms of vaping products. Is alcohol one of the volatiles that's used to as part of the delivery mechanism? Because if it is, then those are illegal. So maybe we kind of pulled something off that we didn't realize that we pulled off, but it takes a little research.
I agree. That's awesome, getting ahead of those high-risk alcohol products.
Yeah.
Awesome.
And thank you, Richard, for always monitoring for us at the state liquor store. So you just keep monitoring for us. Okay.
Well, I can't do it all by myself. So
Well, but
I
you,
need some help. There's plenty of people on here that can.
well, I'm sure. I, on the other hand, just don't want to go in. So, but it is always interesting to go and check out things. So,
I wanted you to see what I'm wearing today. This is my Arkansas prevention t-shirt that I picked up a couple of years ago when I was visiting my aunt.
you're a preventionist through and through, Richard. We appreciate you.
Oh God.
There's something I'm going to throw out. If you notice, there wasn't a huge amount of primary prevention or primary promotion of mental health things. So those are things, but I can't stress enough, don't just come up with like, oh, I have a really great program I want to do. We want good evidence-based policy. That's what we always want to stress and encourage. So if there are things that you come up with, let's chat about it so we can look at maybe working on those things for our coalition efforts. We have a lot of areas that are focusing on depressive symptoms and risk factors related to outcomes of suicide or depression and anxiety. So those are things that, like, it doesn't, we gave you our things that are very focused on substance use. There are things that we can look at that have those shared risk and protective factors. Do not hesitate to talk about this. But don't use something that just feels warm and fuzzy. Let's use evidence and science. I feel like I say that a lot. I like warm and fuzzy, but I also want to have outcomes. So, any other questions? Because otherwise I will give you your 9 minutes back.
I was just wondering if anybody had heard anything specific that we need to watch for, good or bad, that will be coming back up in the interim.
I'm pretty sure there's going to be new cannabis. Oh, there's going to be some more of the hallucinogens, I believe.
I'm sure the alcohol industry is going to continue to work toward liberalization. They're probably going to try to chip away more at the proximity regulations. So
I'm pretty sure that the lobbyist hated me when because I was.
Oh yeah, the lobbyists always hate us, but
She
that's
didn't
okay.
talk to me.
We're not here to be loved.
I'm fine with that, but I was just like, hey, she's like, I'm like, okay.
Yeah.
I don't like your opinion.
I sent a link to an article out, and I can't remember now who I sent it to. I think I sent it to Heidi and Susanna about. It came from the Rutgers, the Journal on Alcohol Studies, and it's really interesting in terms of our kind of collective education and knowledge on how the industry weasels their way into our prevention initiatives to try to distract everybody from the true issue and to water those down. So if you've got that, um, you guys please forward that to everybody so they can read, because it's
Okay.
it's really important. We do have to kind of work hand in glove with the industry folks, but that doesn't mean we give in to them. We have to always be suspicious of what their motives are. Yeah, very good. Um, and Art is the best at this. If they ask for something, we need to say, okay, well, what are you going to do for us in return? So don't give up anything without getting some offset.
Right?
And we need to collectively talk about those and make sure that what we agree to, we support. And that's one of the hardest things with this group, I think, when others kind of do work in the background. We report those back to this committee when we meet, and not everybody's happy to hear what we've accomplished, but it's always a struggle. So just keep that in mind.
It is, but I think this year, the amount of involvement we got from all of you on this call and your peers gives me hope of we're starting to change and getting people engaged in the conversation. Even if something we didn't like passed, I'm grateful for each and every one of you to do this. This is fantastic. And not everyone can run for office. Not everyone can be a chair of a coalition, but we do all have the ability to take 5 minutes out of our day to send an email or say hi to our representatives and our legislators in our communities so that they know who we are and we are involved. And that is my takeaway for the year. So thank you. And we're going to make it even better this year. That's my cheerleader talk. So. Okay. That was it, Heidi.
Awesome. Thank you so much. I really appreciate it. Did anyone have any questions for Susanna, or does anyone have any questions as far as the Bryce Coalition Summit registration?
First of all, I'm going to tell you what Lane just put in there. That might
Yeah.
be a good thing.
Oh yeah.
Because there's a lot of stuff that has happened in the past that's made it limited. So we'll look into that. Thank you.
All right. Well, if no one has any questions, we'll make sure to send out the recording and all the information that we mentioned in the next few days. And once again, I put in a plug for the evaluation that we'll send out. Please be honest. Please share your thoughts and your ideas with us. We really want to do as much as possible to support you. So thank you again so much for tuning in. And thank you to our awesome speaker and all of you guys that shared your insights and ideas with us. Really, we're just so grateful for you and the work that you do. So thanks so much. Have a great day, everyone.